Parent of origin-aware genomic analysis, often called parent of origin testing, is an advanced genetic test that not only identifies genetic variants in a patient, but also helps predict which parent is more likely to carry that variant. It combines two complementary technologies, strand-seq, which generates haplotypes that span entire chromosomes, and long-read sequencing, which provides both sequencing and methylation data. Together, these approaches allow clinicians to predict the parental origin of genetic variants. Traditionally, when clinicians identify a pathogenic variant, both sides of the family are considered equally likely to carry it. To determine segregation, more relatives must be tested, a process that can be time-consuming, dependent on family communication, and often limited by the availability of relatives. Parent of origin testing changes that dynamic. By testing only the patient's sample, it predicts which parent the variant likely came from and provides a more refined risk assessment, offering patients and their families more specific information. This approach brings several important benefits. It provides more accurate risk estimates, helping clinicians focus genetic counseling and testing on the side of the family most likely to be affected, while offering earlier reassurance to the unaffected side. It also supports more efficient use of healthcare resources by streamlining genetic testing, counseling, and surveillance, potentially reducing costs and delays. Parent of origin testing can even inform treatment decisions. For example, in genes such as SDHD, where variants can cause paragangliomas and pheochromocytomas, risk depends on whether the variant came from the mother or the father. Higher if inherited from the father, lower if from the mother. Knowing parental origin helps tailor screening and management accordingly. It's also valuable when parental samples are unavailable. In these cases, parent of origin can still provide meaningful insights into familial segregation, guiding care and counseling. And for families planning future pregnancies, it helps clarify recurrence risk. When a variant appears de novo, and traditional testing shows no variant in parental blood, parent of origin can still indicate which parent is more likely to carry the variant. This can point to gonadal mosaicism, where the variant is present in some, but not all, reproductive cells, offering critical information for reproductive decision-making. Like any new genomic tool, parent of origin testing introduces new considerations. It does not reveal non-paternity or non-biologic parenthood. It simply predicts whether a variant lies on the maternal or paternal haplotype. Confirmatory parental testing is still required to determine actual carrier status, just as in other trio-based analyses. Clinicians should also be aware of potential communication and privacy considerations. If a variant is predicted to come from a specific parent, thoughtful counseling can help manage discussions about possible carrier status while respecting autonomy and confidentiality. Importantly, parent of origin testing provides a prediction, not confirmation, allowing families to decide whether to pursue follow-up testing. Ultimately, parent of origin testing represents an important evolution in precision medicine. It enables faster and more accurate risk assessment, supports efficient use of clinical resources, and informs both treatment and family planning. While ethical and medico-legal considerations should be acknowledged, with appropriate counseling and informed consent, parent of origin testing has the potential to fundamentally transform how we assess and communicate genetic risk, bringing real-time benefits to patients and their families.